guys.
Hi, everybody.
AI Live again.
I know, we're back again. It's been a month already.
I know. Thanks for joining us today. We have some fun topics today.
We do.
We're going to jump into wellness, but before that, how's your month been?
It's been busy at work. I think everybody's staying pretty busy. More people are coming out from COVID, a little bit less frightening. A lot of people have gotten immunized. People are kind of calming down. Things are opening up.
Yeah, definitely. Busier with trainings all of a sudden.
Oh my gosh, trainings are I'm booked out through June. How about you?
Kind of. I don't want to look at my schedule I'm just trying to look forward to my vacation.
And I have people call me and go, do you have next month open? And I'm like, really? Is this a joke? No. Call me for June or July.
Yes, we're doing a lot of videotaping for us here as well.
Yeah.
We have something fun to launch in a couple of months, so keep following.
Super exciting aesthetic immersion news coming up that everybody who's with us, I should say, are going to be following along our pathway. You're going to be really excited about it. So we'll announce it shortly.
All right, but we have some housekeeping things, right?
Housekeeping, we do.
Webinar. Our next webinar is going to be, 2 weeks from now? Mm-hmm. And I'm going to be doing it by myself because this one doesn't do this. We're going to be talking about noses. We're going to be doing a webinar on refining the nose. I'm going to be talking about fillers in the nose and threads in the nose, and we'll probably do a live demonstration, kind of go over that. So if you're interested, you can join us on the webinar Tuesday, March the 16th.
Yep. And then March 23rd and 24th, I know this is short notice, but this is so worth it. This is something that is priceless to anyone who injects. This is a cadaver dissection course. It's 2 days long. There's one day, one the next day, 2 different courses. But it is with Dr. Sebastian Codofano, who's probably one of the absolute top anatomists in the world. I've never seen somebody dissect how this guy can dissect.
Yeah, no, he's really good. I like him because out of a lot of the anatomists out there, he actually brings it down to a level of understanding that's easy. Because a lot of times I think we get into our medical realm and we start talking about lateral, medial, blah, 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 blah. And by the time you catch up to where they are, they're already on to the next topic when you figured out where that nerve was or where that blood vessel was. So Codofano has done a really nice job. He is able to kind of bring it down to a very understandable level. So you're really going to get a lot out of this. There's only really limited amount of spaces. So if you're interested, DM Aesthetic Immersion or email us about it because they're only doing 2 days. I think the first day is the one that's hands-on. You dissect your own head. And then the second day, he's doing a dissection for a conference, but he's allowing a in-studio audience to be there, ask questions, and get involved on that aspect of it.
It's priceless.
It'll be good.
You need to know
somehow we got him to come out.
Yeah, you need to know what's in there. So if you go onto the Instagram, the Aesthetic Immersion Instagram, if you click on the bio, there'll be a link in there. And if you go on our website, then there's a link in there as far as dissection seminar too. So you can go on either place and put your name in for the interest list for that. It'd be awesome.
All right, then our next AI Live.
Next AI Live
next month
is with
just you.
This is near and dear to my heart. This is a cosmetic company. It's called The Route, and it is developed by a dear friend of mine, Nancy Pellegrino, and her colleague. And this is a skincare line that is medically based, but she's been able to put this in Ulta and Dermstore. And the ingredients are amazing. And she's going to tell you about the research that goes into these ingredients and how they work and how our skin has a circadian rhythm and all this stuff that I didn't know about. So we're going to be talking about that a lot the next month. And that's going to be 4/6 on April 6th. The other thing we're going to be talking about is a lot of just skincare. What devices are we using? What products are we using that are really giving us good results in our clinics with skincare? So it's really going to be a skincare topic next month.
Perfect. Then we will be doing, Aesthetic Immersion is kind of hosting the second VI Must, which is a virtual internet conference for Mint Threads. And it's going to be everything about threads. It's a virtual international users, of course. If you're not a user of Mint, you're more than welcome to join it as well. You can register for that, but it's going to be talking all about the different techniques that we're doing. There are different practitioners from around the country that will be invited to speak at it. So it's a full day event. If you guys are into threads or wanting to learn about threads, it should be a great conference. So join. I think it's only like $49 right now.
It might have gone up to $99 in March, but it's a whole day, you guys. It's a whole day, and there's a cadaver dissection in that. That's a smaller dissection, but it's going to be really, really good. Yeah. It's a whole day of learning about threads, so it's well worth it.
It is. So what else? Yeah. What else is there?
So we have FOA and FOAD. So we have Foundations of Advanced Aesthetics, and we have Foundations of Advanced Aesthetics for Dentists. Mm-hmm. Both those courses are going on March 20th and May 1st.
Right.
So we've got those courses going on. So you can sign up if you want hands-on. Just keep in mind for those courses.
Yeah, these are our foundation courses. Yeah. These are for you guys who are just getting started or don't have any experience on it, or have been in it for a year, 2 years, and really have not taken a very good foundations course. This is kind of for you guys. We're going to go into anatomy, really in depth on toxins, rheologies, fillers. We really kind of get into it. It's like our didactic portion is going to be online. Yeah. So the earlier you join it, the earlier you get to review all of this. It's over 12 or 14 hours of material. So it's a lot. And then once you're done with that, then you can come to our class and do the hands-on where you get it recorded and you get to spend an hour with one of us kind of walking you hands-on, one-on-one.
You get to be with us one-on-one, which I think is so important. And
it's been fun thus
people don't get it when they go to other courses. And what I love hearing from our students when they've gone to other courses is they tell us, oh my gosh, I learned so much in your course that I didn't learn in these other courses. Yeah. I learned to inject here, but I didn't learn as to why. Yeah. Like, why am I looking at that? Why am I injecting there? We teach why you're doing what you're doing. Yeah. And it lets you go anywhere and take that information, that critical thinking with you anywhere to any patient and know why you're doing what you're doing. And I think that's why our courses have been in such demand. And I'm so happy to hear the feedback from our students. Mm-hmm. So it's awesome.
And lastly, we have actually our specialty courses. So this is specialty hands-on courses. It'll be Saturday, April 17th. I think the beginning AM session is going to be chin and jawline. So there's an online didactic as well. And then you come in for the hands-on, and we're going to be injecting chins and jawlines on your models. And then in the afternoon is going to be on temples and under eyes. So I know these are a lot of the off-label areas that everybody wants to learn. Yeah. So we decided to have a hands-on course. So AM is chin and jawline. PM is going to be temples and under eyes. That's going to be April 17th.
Now for those courses and for FOA and FOAD, we do require that you watch the modules, take the tests before you come. So that has to be completed before you come to the courses. The other one is for the specialty course. You do need a 1-year injecting experience or equivalence. So that means if you're injecting 1 day a month, you better have been doing this for a few years before you come. Yeah. So at least a year of injecting hands-on or equivalent of that 1 year before you come and do the specialty workshops.
All right. I think we're done with our announcements.
Enough announcements.
We are going to jump into our topic today, which is wellness. I think with everything that's happened this last year, this has come a lot more in the forefront. I think everybody has brought it in mind. I mean, I think health is super important. A lot of people have figured it out this year, hopefully, that, without good health, if you can have all the money in the world, you really still don't have anything without your health. Mm-hmm. So we decided to do this topic. I think as part of my interest and Lori's interest as far as we start to get into, further in our careers, like what other things can benefit ourselves.
Right. What other adjuncts can we use so we stay healthy?
So we brought in our amazing friend, Dr. Jacquelyn Cortez. And she has a great clinic out in Anaheim, and she does a lot of this integrative medicine, and she's at the forefront of it all. So she's going to be talking with us today about everything wellness, all the different things, IV drips and other things that are going to be supplements and things like that you guys can start to take yourselves and potentially start to maybe integrate into your practices, right?
Yes, absolutely.
Awesome. So I think we're gonna jump right into it, right, guys? I think she brought a great
presentation
PowerPoint.
that's gonna everything about immune health, basically.
Yes, pretty much. Yeah, it's really been a wild year. I think all of us can attest to that in multiple capacities. And it's tough because I think all of us being plugged into social media and then also like sort of being glued to the news, it's difficult to have a filter. And I often tell my patients this is why providers will never be obsolete, because we can act to be that filter. Google doesn't provide that for us. So we get good news, bad news, and different news. And it's very difficult as a consumer of that news to know what's really true.
Yeah, unfortunately. Unfortunately, you have information, which is good, but a lot of times, a lot of that information is maybe not bad, but put in the wrong context. And,
correct.
If you don't see the bigger picture, you're going to miss a reason why that actually works.
Absolutely. And what I've actually found, like a little quick tip for a lot of our providers out there, I found that some of the information that's even 5-10 years old is actually better because it's not as charged. If we can just not get kicked off the internet tonight, that would be super. So you know what I mean. So there's a lot of research that's been done about why, and I had a great question last March. One of my patients asked me, why does azithromycin work for bronchitis? You're giving me azithromycin. She had a bad case of bronchitis. I'm like, look, let's just nip it in the bud, give you azithromycin, give you a Z-Pak. And she's like, why does that work? It's an antibiotic. It's for bacteria. And I'm like, I don't know. I've been doing it for 20 years. I don't know why it works. And so I went back and I really had to dig. And honestly, I did not dig that hard. I'm not even gonna lie, but dug a little bit. And it actually has antiviral and antioxidant properties. It has been documented that it actually benefits for influenza-like viruses, for influenza itself, SARS-1, multiple other viruses. It's actually been shown to be statistically significant benefits. So that's why it
hence
works.
The reason they're using it for COVID now.
Yes, you said it. I didn't say it. So, and same with Levaquin, same with a number of other things that we traditionally think of as antibacterial only actually have other benefits. And so again, we were kind of alluding earlier to some of the little topics that pop into my head at midnight because I don't sleep because I was formerly an obstetrician. And it's kind of thinking about things that there's like sort of more than one purpose. Like you had one job. Right. And that used to be a meme, but it's not really anymore. Things have more than one job. # ivermectin, # hydroxychloroquine. Things have more than one purpose now. So we sort of have to think outside the box. Gideon and I went to school, or Dr. Kwok and I went to school together. And when we went to school, vitamin D had one purpose. Right. It was for bone strength. That was it. You memorized vitamin D equals bones. When you found that question on the test, you circled B for bone, and you went to the next question, which was like vitamin B equals like it turns your pee yellow, and you go to the next question. Like that was it. There was no other, right? There was no other purpose for it. And so, now we understand it's so critical for thyroid health. It is so critical for immune health, hugely fundamental for immune health. And there's been no less than, I want to say, that I've personally read at least 5 studies about vitamin D this year, but I want to say without exaggeration, there's been at least 30, if not 50 studies about vitamin D this year, just in regards to immune health and its benefits against this pandemic. So for both prevention and actual treatment of, for preventing mortality, for preventing ICU admission, for preventing even getting infected, which is even different than what they're saying the efficacy of the current vaccines are, because they're even admitting freely that those are not preventing infection or transmission. So, but vitamin D can. So it's very interesting how just protecting your wellness alone and this whole approach can really benefit just your overall health, because this one is not going to go away. So the narrative of like, oh, it's going to go away and we're going to beat this thing. No, it's not. It's going to mutate and change just like all coronaviruses do. So they're kind of, their life cycle is on like a 48-hour life cycle. Our life cycle is on a 48-hour or 48-year life cycle. Hopefully not 48 hours. And so it takes us a lot longer to mutate, right? Because it takes us so much longer to reproduce. They're 48 hours. So they're going to mutate, takes us longer to catch on. But then there's rhinoviruses and there's noroviruses, et cetera, et cetera. So we're always going to be faced with something. So we still fundamentally have to have that immune system to keep us going. So how do we protect it is kind of the bigger question.
Right.
So do you have anything you'd like for me to touch on before I get started with my little lame
No, let's jump
PowerPoint
into
thing
it.
that
We
I
might
like-
ask you questions while you're going along.
I
Super.
know.
Okay. And so, because I totally like did this thinking that I was like teaching my PA students.
Perfect.
Like
Awesome.
I didn't even.
That's what we are.
Perfect.
Yeah, I kind of like flaked on the idea that, okay, yeah, because the immune system is really bigger than just like white blood cells. And again, I think that this is something that as providers, we sometimes forget. And again, in the greater like mainstream media is sort of like white blood cells and we have our antibodies and that's it. And if you don't have antibodies, you don't have anything else. And I think we disregard a lot of the other aspects of our immune system, i.e. our skin, right? Which is something we're huge experts about here in this industry. Our skin is our largest organ.
Right.
It is oftentimes a reflection of our greater overall health. We see this all the time with blemishes, rashes, rosacea, psoriasis. We see when our internal health is not working appropriately, it manifests on the skin.
Yes.
But also we have our normal skin flora that we are decimating with the quats that we're using on all of our surfaces, that we're inhaling, we're washing with sanitizer, we're like bathing in it for heaven's sakes. And we are absolutely just obliterating all of our skin flora that is supposed to be there.
Right.
And those are space savers to help avoid things like taking hold where,
Right.
avoiding those bacteria and viruses that are out there trying to attack us. The respiratory tract as well, guys, this is supposed to protect us. We have hairs and we have cilia all down our respiratory tract. Now, this is where I'm going to get a little controversial, right? So you can name me, anybody here in the room, all welcome to chime in. Anybody can name me one organism on the planet, living organism, who has designed something, a flap, a skin, a tissue, to go in front of their nares to protect them from viruses, bacteria, pathogens. Anytime now.
Not that I know of.
Not a one.
No.
There's not one. Not that I can think of. I can't recall any. And so, again, there's like the sharks have like the third eyelid that goes across to protect their eyes and that sort of thing. There's a various number of amphibians and so forth that'll protect eyes, but there's not one that will protect their airway. And yet here we've come up with, maybe not one mask, two masks, three masks. And yet again, if you go back to data that is decades old, we have done these studies time and time and time again if masks are beneficial, and the answer unequivocally has been no. There's no statistical benefit for masks, paper or otherwise, unless it is a well-fitted, tested N95 mask in a medical setting where it's actually been tested in the setting of tuberculosis only, which is a different bug than viruses.
It's
bacteria.
a much bigger organism.
It's a much bigger organism. It's a
For
bacteria, which is way, way, way different than
For
a
sure.
virus. So again, when we take this all out of context and just unequivocally like extrapolate it forward and say, okay, just everybody wear masks all over the place.
Right.
And we've got N95s from like the gardening section at Home
Right.
Depot. And it's like up here and down here, and we're having little 7-year-olds wear it and it's getting into their
And we're not
eyeballs.
changing it every
And
time.
yeah, and right. And we're wearing it for 7 days and it's been in our back pocket and we've done all number of things out of our backside. Like that's,
Or the floor of our car or the bottom of our purse.
you know, I'm not gonna
Wherever it
lie.
might
When
be.
I'm heading over to Starbucks, I might be reaching around. And
Right.
Where's my mask?
And people arguably, well, why do you wear them in the OR? Yeah, but I'm not reaching out of the back of my
Well, if you
car
touch
to grab
yourself
one.
in the OR, you're taking that mask off,
Right
you're
off,
getting
yep,
out,
exactly.
re-scrubbing back in. So
We
it's
have
a
very
different.
strict rules in the
Yeah.
OR. We're not allowed to reach above our shoulders or below our waist. We don't scratch anything on our face. We
Mhm.
can't touch our masks. And again, really, even the studies that have been done in the OR regarding masks have not shown a benefit.
No,
from
I
masks.
read one.
Yeah,
I read
yeah,
one Where a surgeon actually decided to do
Like, let's check
surgeries
this
for
out.
6 months without wearing a mask,
Yeah.
and he did not see any increase in his infection rates.
Yep, no benefit. And so I think really that is just so we do not spit or put
Right.
snot into the
Right.
incision physically.
Makes
Like that's
sense.
really
I
what it
agree.
comes down to. So,
Right.
it just honestly like that.
Which is where we're at right now.
Yes, as we're seeing
We're looking
states
at we don't
kind
want
of
to spit
opening
and
up.
cough up something.
Yeah, droplets and
Yeah,
that sort of thing.
the
And so again,
droplets.
I think in the interest in the beginning when it was like, gosh, can we just do something? Like, can anybody do anything in that panicked state that we were in? And it was understandable. Yes, then do something, right? Always better to do something than to do nothing. And we were all kind of paralyzed. But now that we've all been able to like, okay, pardon the pun, but take a breath. Take a breath now. and really analyze where are we left, then I think we're starting to understand, you know what, and particularly given the two coasts, right? We've got Florida, we've got California, one who's like hog wild, crazy, Miami Beach, you know, topless, whatever, and maskless. Oh, sorry, did I say topless? So maskless over there. And then California, that's been like one of the most, you know, strict. Are there any difference in outcomes? And the answer is really no. So there you are, like case study right there. So with that said, then the respiratory tract is part of our immune system. It is designed already to help protect us. So let it happen, because that cough that we're manifesting, that sneeze, is designed to kick that stuff out, right?
Now everybody doesn't want to cough.
I know.
If you cough, you are like, it's easier to like pass
but
gas
I tell you what,
than cough nowadays.
If you want to get to the front of the line at the grocery store, cough.
Right?
You will clear it out, man. It is like nuclear holocaust.
Like
yeah, it is awesome.
And it was like, we're trying not to cough.
Yeah, it's like they're going to blow it out of their ears. Yeah, so, you know, really, guys, and that's another thing about the masks, is that we're then coughing into our masks and we're sucking it back in.
Right.
And the CDC came out very, like, quietly, like they went out loudly and then sucked it back in, right? Which is kind of what we're doing in the mask. That 76% of new cases, they did this in August, that 76% of new cases were heavy mask wearers, like all the time or most of the time mask wearers.
Wow.
Yeah. Because literally we're like sucking in these little viral particles and our body's like, like, I don't want it. They're breathing it out. And then we're sucking it right back in because we're holding it. It's kind of like wearing grandfather's handkerchief, which we don't use handkerchiefs anymore. We don't use them because they're gross. Like, it's gross.
Yeah.
We use Kleenex and dispose of it. So now we're literally using grandpa's handkerchief for weeks on end, and we can't figure out why we're all getting sick. And there's been a lot of pulmonologists coming out and saying we're seeing a lot more bacterial pneumonia as a result as well. They're thinking it's because we're trapping bacteria. Again, human bites are the worst, most disgusting bites that you can sustain because we have so much bacteria. And again, now we're breathing all of that and then sucking it back into our lower airway. That's not good for us. It's just not helpful. Anyway, moving on. Intestinal tract, huge aspect of our immune system that, again, we're not taking care of. We're eating fast food. Fast food restaurants open. Whole Foods closed. I don't understand what's going on here.
What the heck?
But, so definitely take care of our intestinal tract, take care of the dietary, making sure that we're eating whole, healthful foods. I'm not a big proponent for any one particular diet. I don't care if you intermittent fast. I don't care if you keto, Mediterranean, it doesn't matter. I usually counsel my patients, eat whole, healthful food. So fruits, vegetables, lean proteins, whole grains, done.
Stay on the outside of your
outside aisles. Why is that? Do you know why that is? Have you put it together? Because those are closest to the exits. And so those are the foods that go bad easiest. So all the inside aisles are your frozens and your cans. So they stay on the shelves longer. So they can pack them in and leave them longer. So those are the foods that you want to shop.
I thought it was because it's easier for people to see the shelves. And it's further away for people to get to the really good stuff.
It's purely a stocking issue. So that stocking so they can expel the produce and the meat section easier. And so a lot of people are like, read labels, read labels, read labels. The reality is if it's a whole fresh food, it doesn't have a freaking label.
Yeah. True.
There are no labels on apples. So reading a label, you probably shouldn't be eating it. Yeah. So, it's just kind of come back to the basics, right? So there's that. And then the lymphatics. And actually one of the most surprising articles I read, because I've had a lot of patients with long COVID. And so they're still having decreased sense of taste and smell. Mm-hmm. I don't know if you remember this, Gideon, but it kind of struck home with me, I think, because Karamati, who is a dentist. I don't think that's why he left, but dentists have a higher rate of suicide because they were losing their sense of smell because of the amalgam. And so it was getting into their olfactory nerve and kind of killing their sense of smell. And they were like losing their sense of taste as a result, kind of losing their pleasure centers because it's very close to their amygdala and hypothalamus. And it caused depression and they had higher rates of suicide. And so now we're seeing this with long COVID is that they're continuing to have a loss of sense of smell.
Right.
So anyhow, I was like reading this article, how are we getting it back? And one of the answers was lymphatic drainage. And I'm like, let's hear it for the osteopaths. Yay!
Right.
And this was not in the Journal of American Osteopathic Association. It was in the British Journal of Medicine. I was like, yes.
Wow.
So they're saying that some of the the long-term olfactory nerve issues.
Yes.
So what are they doing?
So we're doing
but
lymphatic drainage, but what that's about is like opening up the supraclavicular fossa, particularly the thoracic duct on the left, and then basically addressing the anterior cervical chain. So you want to go proximal, and then middle, and then distal. So up by basically along the SCM, so your sternocleidomastoid. And just basically milking it all the way down like if it's a tube of toothpaste. So you go from the beginning of the tube of toothpaste, then the middle, all of you people who don't do the tube of toothpaste right, and you know who you are, right? And then all the way from the very back of the tube of toothpaste. So all the way down, you're going to do that on both sides. Right. It can be very simple, just as simple as that. So really anybody can do it. You don't have to necessarily be officially trained.
What's the theory behind that?
Yes. So basically they know that COVID crosses the blood-brain barrier. And then creates inflammatory cytokines that sort of then get stuck. And so it creates that inflammation at the olfactory nerve, the hypothalamus.
I was just thinking about that. So after COVID's done, I was thinking a lot of that the acute inflammatory process is over, but because of the lack of smell and taste, smell related to taste, but the inflammatory process is still going on.
Yes.
So exosomes would work.
Yes, exosomes would work. Absolutely. Yeah. And again, people are sometimes the best answers are the simplest, right? Okay. Using our hands. It's 10 minutes to do lymphatic drainage. 10 minutes. Do it once a week. And it's phenomenal results. I'm getting phenomenal results in my practice. It's free. The overhead for that, right? Exosomes cost, it's an overhead that's much, much higher to attain. So while the ROI on that from the practice standpoint is better, but still, if you don't have that ability to invest in your practice, like a little baby practice, you may not have that ability, but certainly for me to give my expertise and skill, it's definitely something that I can introduce to my practice. Or if you have a patient who genuinely can't because they're still paying their medical bills from being in the hospital for their COVID, it's something that's definitely attainable for them.
So is there a time frame with this lymphatic drainage with return of senses?
Usually like right when they're walking out of the office, they're already feeling better. And then what I found is their sense of smell is sort of blinking in and out like a Wi-Fi signal. So they'll feel it come back and then like, no. And then, a little bit, and then no. And it'll last for a couple days, and then it sort of fades out again, and then they come back in a week. And so I've been doing it now for about 3-4 weeks. And so I haven't had anybody have permanent return yet, but it is getting longer before it disappears again.
That's
so
cool.
I'm waiting to see it maintained.
That's interesting.
Yeah, so just really, really cool. So just kind of getting rid of those inflammatory proteins. The other thing that helps with that is zinc. Is really, really huge. So kind of just showing how zinc deficient we are. So again, those are just antioxidants and anti-inflammatory properties of things.
Now, zinc has been a huge thing with COVID. It's been huge. Can you tell us, and viruses in general, so can you explain to our audience how zinc works as an antiviral per se?
Yes.
How does it work?
Oh my gosh, I love zinc. Zinc's amazing. So again, zinc was like, it's a mineral. We need zinc. Zinc's a cofactor, right? So zinc is huge. Zinc is in about 2,000 biochemical pathways in our body. It is that profound. And then it's like in 100 plus cofactors. And I hated biochemistry. I hated it.
Right.
And now it's like all I do all day is like body's chemistry and the hormones and all the stuff. So now I just love it. I hated it sitting in the classroom. Nonetheless, so back to the question, what zinc does is it actually changes the surface of the cell membrane in some way that I don't know that we fully understand, but it basically then repels the virus such that it can't gain entry. So it just sort of like makes this blockade. So already, if it can't get in, it cannot replicate.
Right.
So it's dead in the water. So if you're just already up on your zinc, you're good, man.
Right. You can have the virus in you, but
bring it on.
As long as it doesn't attack.
Come at me, bro.
Yeah.
But then this is where we get, right? Where my little thought process was going, where more is not always better. Right? So doubling up on your zinc is not necessarily a great idea because it's one of those micronutrients, micro being the key phrase. We only need it in small amounts. So about 30 to 50 milligrams is all you need because in higher amounts, it blocks our copper and iron absorption. So then we get other issues. So we've got to be very cautious about how we coach our patients, not like zinc, 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 like yes, zinc. but right?
Okay.
Zinc can also cause a lot of nausea. So we've got to be cautious about the way that we administer it. So some people can tolerate it, some people can't.
Is that where I dry heave on the way to work?
Yes.
Just
That's
wondering.
the one.
What the heck?
So it's available in lozenges. There's nasal spray.
Just get your IVs.
Yeah, through the IV. So a lot of times then IV, that's like kind of the only way I can take it. And I'm so sad because I've made like the most beautiful immune complex, which I brought you guys, by the way. I can't take it because I get sick and I bruise from the turmeric. So like I can't even take my own stuff, but I brought some for you guys. But
Thank you.
But yeah, so zinc is amazing, but more is not always better. So just be cautious about that. But and then also it acts as an anti-inflammatory. So again, it's antiviral because of the not replicating, but it's anti-inflammatory as well, and from a very fundamental standpoint. So steroids block like IL-6, IL-8, IL-10, right? I think IL-1 and 2. And TNF alpha, something like this, right?
Okay.
Hydroxychloroquine blocks a little bit earlier in that cascade. So there's like a number of other of the IL family that it blocks. So that's why it works really well as an anti-inflammatory. Zinc blows all those guys out of the water, right? It blows them out of the water because it gets all the way back at the beginning of the cascade and it prevents the decoupling of NF-kappa beta at A20. So A20 has to come in and it like actually decouples NF-kappa beta from IKK and like where that guy pops off and then begins the whole inflammatory cascade. Doesn't even let that happen. So I liken it to steroids kind of helps to capture like the little black sheep as they got let out, like the whole herd gets let out of the barn. They capture the little black and the brown sheep. So it's not too controversial to say, I know.
No.
So it captures those guys, right? Hydroxychloroquine sort of puts like a net over whatever sheep it can catch. So it captures like a little bit more. Zinc doesn't even let the barn door open. It's like, fa-chow, like doesn't let any sheep out of the barn. So it's really incredible as an anti-inflammatory. And so again, there's a great commercial out right now, which I'm not a big proponent of doctors being on commercials, like unless it's me. Leaving options open for people. But it's about like a fruits and veggies, vitamin, something. And he says very distinctly, I picked up on it. He says, I was amazed to see how well my patients did when they took it appropriately, like they took it regularly, something to that effect. And that's the key, right? It's not that I took zinc once every time I sort of remembered it because it was sitting on my bathroom counter. It's like they took it as directed regularly. And that's it, right? You've got to take your D regularly. You've got to take your zinc regularly. Stay on top of these things. Yes, you can use some of them as rescue dosing. Like I'm going to get into how you use D as a rescue dose, but also just staying on these things and maintaining that immune system is going to be crucial in protecting your overall health down the line. So that's going to be a big factor for sure.
Excellent.
Right. So guys, we got through our first slide. I'm so excited. This is why I can't be trusted with PowerPoints. Oh my goodness. Okay, so I'm going to get to some of the other, like some of our other guys. Okay, so vitamin D, I kind of alluded to. So vitamin D is the D3 is really the critical one. So when you guys get a D level, it takes about 5 days to come back. There are actually kits that you can get to run it in your office. And it's kind of like, yeah, you really suck with your vitamin D level, or you kind of have a moderate level, or you're way too high. That's kind of arguable because where I like my patients is what other people would call way too high and like caution, danger, but that's where I like my patients. I like them usually at about a level of 70 to 80, which most other Western doctors would flip their lids about. But there's a difference between what is a normal level and what is a functional optimal level. And I don't know that we actually have not established what is a functional optimal level. We established a normal level based on rickets, right? So rickets is when you spontaneously break your bones when you're learning to walk.
Right.
And so we figured out that we were doing that because we didn't have enough vitamin D. We found out that vitamin D came from sunshine. And we said, oh, when that vitamin D level is above 30, you no longer spontaneously break your bones. Good job, everybody. That level is 30. So now when we're running around with a level of like 20, we're like, it's pretty good. You're almost at 30. So I guess that's all right. So we're still like the vast majority of us kind of insufficient, but not considered deficient. And then even when you're considered not insufficient, but normal, you're barely not breaking your bones. that's not really optimal. That
It's
just
true.
means you don't suck. So not sucking is also not winning the race,
True.
right? So really we need to be substantially higher. And again, this is where when, again, Western or conventional docs are telling you, and it's not to trash on Western docs, again, it's just where we're not really trained in this
We're not.
manner. We're just not given that information. Oh, the information is controversial. There's no data to support that, right? We're hearing this all the time. It's true of vitamin C. It's true of vitamin D. It's true of zinc. What they mean is that there's no consensus about what is that optimal level. The studies are all cattywampus about dosing, about mechanism of dosing, about what are their standards of what they're considering normal. So some of the studies say that 50 is a normal. Others are saying 30 is a normal. So it's hard to compare that data and kind of cross-match it because they're moving the goalposts all over the place. So it's like, how do you extrapolate then what is an actual treatment regimen? And in a very protocol-based world, evidence-based medicine that everybody's relying on, it's difficult then to discern what's going to be best for my patient because everybody's
True.
waiting for the recipe.
Right.
Like, okay, then what do I
That's
do? What do I tell my
medicine
patient?
is done to this.
Yes.
Our field.
I've always known that it's a fat soluble vitamin.
Yes.
So at what point do we back off of something that stays in the body for quite a while?
Yeah.
So
Yeah.
we always worry about ADEC, A, D, E, and K.
Yes. And so we don't want to go too high. So this is the other interesting factoid about it, an interesting history, because everybody's like, no, it's too high, it's too high. In fact, I had a pharmacist that I got in an argument. I literally sent him 6 articles because I wanted to give 50,000 units for 3 days. That's the vitamin D hammer, 50,000 units for 3 days straight. And it will literally turn patients' viral symptoms around within 24 to 36 hours. They are done. They are symptom free. They are writing your Yelp review that you are the best provider on the planet. It is incredible. Fever's gone, snuffy nose gone, everything gone. They're amazing, right?
Wow.
Between that and IV hydration, gone, done. Forget ivermectin, forget Z-Pak, like vitamin D hammer, done. He wouldn't dispense it. He would not dispense it. Nope, not doing it. You're gonna make your patient toxic. Now remember, we're all starting with a level of like 12.
Yeah.
Right? Like
Right.
unless you live in Florida or Arizona, you're starting with a level of 12 or 20 at best. And so he wouldn't dispense it. So I sent him all these articles that said like they're doing studies with people who have like, they're getting 600,000 international units, right? They're getting a metric boatload of this
Wow.
stuff, which I could choose some other words, but metric boatload, it's rated G. And he wouldn't dispense it. So what we put as the upper limit of normal is 100. Right? So above 100 is toxic. Oh, you can't do this. No, right? Actually, they found toxicity at 300. And so they said, well, we don't really want people to get toxic. So let's just say we're toxic at 100. So if people get above 100, we're not really doing any damage. So now everybody gets in their head like, oh, at 100 is toxic. So let's like keep them down around 30 so we don't get anywhere near 100 when really people aren't even toxic until 300. And so it's just, again, where we're not taught the nuances of it.
No.
And like really where these people need to be living.
Right.
And nor have we even taken the time to see where people are optimal. But what I can tell you is study after study has been done, and even particularly this year, about these rescue doses of vitamin D. And again, there's been different regimens. So some are like 35,000 for 7 days. I do things in threes because again, obstetrics, we do things in threes and there's no science to it. It's just superstition, but we swab iodine 3 times. There's no science, but we just do. So I think you can remember things, to do things for 3 days and then you fall off. So I just do 50,000 for 3 days.
medicine.
Yes. But at least I admit it, right? I don't lie to you and tell you
You're
there's
so
science.
real. It's totally
Just
not.
is. So
Yeah.
but my patients just love that regimen. So it's a really good one. So I say anybody over the age of 12. And again, if you have like a 60-pound 12-year-old, please don't give them that much. But like a reasonably sized, like my 12-year-old's taller than I am, right? So if you have a reasonably sized 12-year-old, anybody 12 and older, 50,000 for the 3 days. Because again, vast majority of us are either like a normal level or lower, you can assume. Again, 25% of the US population is vitamin D insufficient or deficient. It's 1 in 4, guys. So it's pretty significant. Okay. All right.
It's okay. We can go
let's
longer.
Yeah, I know. We can talk for days.
This
I already
is
told Gladys.
this
Okay.
information
There's so
is
much
so
information,
good.
you guys.
So
There's so
much.
much good information.
There's so much. Yes, definitely. And so again, you guys can post this, right? You can post the regimens here because I gave like kid dosing for zinc and D and all this stuff.
Yes, they can. They can email us.
Yeah, you can DM.
Reach out to us.
Yeah, all the things. And then vitamin C as well. So again, a lot of questions about how much C. So the rate limiting step for C is your receptors in your intestines, how much you can actually absorb, right? So people are all proud of themselves. I take 5,000. That's great. One, you're going to give yourself diarrhea, so you're going to dehydrate yourself. And two, you're going to are going to saturate your receptors. So you're just not going to suck any more in. It's just not going to go. So if you want that much, then get it IV because we're going to bypass those intestinal receptors. And so, no go. So 1,000 to 2,000 orally is usually what you can take.
Excellent.
So go about there. But vitamin C is fantastic as an antioxidant. It's fantastic for tissue repair, anti-inflammatory. It helps increase the number of our white blood cells, which is really, really cool. And our interferons, which help with antiviral activity as well.
Excellent.
Yeah. Glutathione. Glutathione, hugely underrepresented.
Oh my gosh, this is the big one.
It is.
Glutathione.
My pharmacist created something.
What?
Transdermal nanoparticles absorbs through transdermally.
Oh my goodness.
15 minutes, 90% absorption.
Stop it right now.
No, it detoxes you. We were playing with it on my staff, and it literally they felt sick literally with just 4 or 5 sprays that night.
Oh my goodness.
Because the body was actually going through a detoxing. They felt like they were getting feverish and they're like, oh my God, I'm getting a flu or something like that.
See,
and
this is
really
huge.
The 4 or 5 people that were doing it were just like, what? They were only the people that actually bought it and were doing it. And so I've been doing it now for about a month and a half, and it really is, you can feel that it's detoxing you.
Yeah.
It is like the super antioxidants. And when we're talking about antioxidants, it's about getting rid of these free radicals, just aging process.
Yeah.
People don't realize free radicals and what they're doing. They're really, really just, free radicals are part of the normal oxidation process, the normal functioning of the body that causes to age.
Yes.
And so what they do is they steal electrons from things that are around it. If they're high antioxidants like vitamin C, vitamin E, all of those that are around it, they'll donate their electron. They'll give it to the free radicals so they kind of neutralize them. They don't wreak havoc.
Yes.
But if there aren't the high antioxidants, then they start to damage your DNA.
Yes.
And that's how you get these mutations, cancers. It leads down a whole route of disease processes out there that people don't realize. And so I was reading up on glutathione, and I'm just like
blown away.
It's blowing me away.
Yeah.
Like I do glutathione and like vitamin C as like IVs because popular in the Asian community as a whitening shot.
Yes, it helps to lighten
and
the skin.
Definitely, we know a lot of people take silymarin, milk thistle as a precursor to try and stimulate glutathione, to stimulate it as a supplement, but still not as powerful as actually just getting IV. But the pharmacist that I found literally transdermally.
Yes.
I mean,
and that's been one of
he's done tons of research on it.
And again, that's been one of the rate limiting steps with glutathione is how to get it absorbed orally, because and that's why we've done the milk thistle and the N-acetylcysteine and so forth, is because we didn't think it could really be absorbed orally. So the liposomal glutathione is better absorbed or IV, or now I guess transdermal, which is so exciting.
This one's huge.
Perfect. Yeah, and I think what a lot of people don't understand about the free radicals is that they continue to do damage.
Yes.
So it's not like it's one little free radical running around. He creates a huge, just ripple effect. Like it's just everything he touches is just ping, 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 ping. And so it's whack-a-mole. And so it just continues to set off this domino effect. And they can just be really, really damaging. And like you say, depending on what mechanism it's setting off, is that going to be the one piece of DNA that gets damaged, or that one little light switch that gets kicked on, that's going to be that cancer cell, or going to be some other irreparable damage that's getting thrown out.
Yeah, if we can prevent that and downregulate those free radicals,
absolutely,
there's no downside to that.
Absolutely.
That's
a good thing.
Aging slows.
Yep.
Aging slows down. I mean,
for sure.
The oxidation process in the free radicals age you.
Yeah.
And that's what it's all about. How can we mitigate aging?
Yes. And the interesting thing about glutathione, though, just to be really cautious about, check liver function tests, because it does get cleared through the liver. And if we're using it in higher doses, you just want to be sure that they're able to clear it, because otherwise you do get that really toxic feeling and headaches and lethargy and body aches and so forth. So you want to make sure that they're able to actually clear it out. So that is one of the things that has been reported.
Start off slow.
Yeah,
With the spray, start off slow.
You gave your staff the high dose
Again,
one.
my gosh.
It does come in a lower dose.
Okay, Pfizer. Yeah. So
I was told. I was trying
guys,
it.
try this.
I tried this. Yeah. I'm not gonna lie. I think I might have done that to my daughter with laser. Yeah. All right. And then quercetin, which is another big one that's kind of come on the scene. I didn't know a whole lot about it, but it's a flavonoid. And again, one of those like words that gets kind of tossed around, but the flavonoids are anti-inflammatory. The whole B family are all flavonoids as well. So anti-inflammatory, they decrease lung inflammation. So our asthmatics, COPDers, smokers, vapors, you know who you are. I don't know why I looked at you for that. Lori's not a vapor.
Not a vapor.
No. But also, again, the brain fog. So people who are cognitively disinclined. So those of us who are studying.
All of us as we age.
Oh my goodness.
All of us
Finally
as
brought
we
me right
age.
next. I know there's
Quercetin.
quercetin in it.
Yeah. Oh, yeah. And it potentiates turmeric as well. So the benefits, anti-inflammatory benefits of turmeric, it helps to potentiate that guy as well. So again, sometimes the whole is greater than the sum of its parts. So like a brownie is not just sugar and flour and chocolate chips. Like it's bigger than that. So.
Right.
I don't know why I use brown.
Much bigger than that.
Yeah, so much more.
Much bigger than that.
But yeah, so it again that we're seeing so many effects of aging cognitively, and I think all of us are sort of wondering, is Prevagen the best thing, or this brand or that brand? We see so much in media, commercials, etc., and we're all kind of wondering. So if we go back and we understand the fundamentals, then we know at least what ingredients to look for, so that we can best advise our patients, or best, help ourselves to, get the good stuff in us.
That's awesome.
For sure. It also kind of is a little bit of a blood thinner. So again, why I can't take my own stuff, because then I bruise everywhere. Like I lean over a countertop and I've got bruises all across my stomach. So something to be aware of. And this is where, again, not all vitamins are good for everybody. So if you've got somebody who's on anticoagulant therapy already, they're former stroke patients, they're, an artificial heart valve, they're on Plavix, they're on warfarin, be a little bit cautious about how you're dosing them. Vitamin C as well, you've got to withhold 7 days before surgery. So because they're going to bleed a little bit longer and more during surgery. So you really have to know your vitamins if you're going to be implementing them in your office. Just to be aware of what other things are going on in your patient's world, so that you're not interacting. Vitamin D plus K is a big thing, because the K helps to kind of plant it where it's supposed to be. It helps it to absorb. But again, if you've got patients who are on anticoagulant therapy, or if you're doing your vitamin D hammer, make sure you're prescribing like the 50,000, or Orthomolecular has one where it's a 50,000 in one capsule. So you're not don't take 10 of your 5,000 plus K, because then you're also increasing your K, which increases your risk of clotting. So you just want to be very aware of exactly what formulation your patients are taking. Make sure, again, not that necessarily, Mothers or Amazon or Walmart are bad, but that they, are taking good quality supplement, and it's something that know what other things are in there, fillers and so forth. Yeah. I think I'm like kind of done. Probiotics. Oh my God, this is a big deal. Okay, so gut-lung axis. This is a thing. Did you know this? I didn't know this. I don't know. I might have known this. Like for one day in embryology, I think I might have known this. Gut and lung come from the same embryological
Interesting.
origins.
Did not know that.
Yeah, and it makes sense, because then when you think about like esophageal tracheal atresia, like it's because the same little tubes didn't separate, right? So then it like all of a sudden makes sense. But I did not remember that. So again, if you have gut dysbiosis, you are going to have lung inflammation, and vice versa. So if you can get your gut straight, your asthmatics are going to do better. If you can get your asthma under control, you'll have less GERD. And, so we talk a lot about the gut-brain communication. I think there's been a lot of study on the microbiome and so forth. But particularly in this last year, when people have been on steroids, they've been on antibiotics, they've been doing a lot of this stuff, we've been just destroying the gut microbiome and not going back and fixing it. So critical to get on some good probiotics. There has, again, not been a consensus. Lactobacillus has been the most studied, about bifidobacterium, and there's been a lot of other brain fog. There have been a lot of different strains that have been studied. So again, just talk with your provider about which one is a good one, or get with different companies, interview them, make sure that they have a good quality. I usually like a spore-based probiotic because it's in a little cocoon. It doesn't get disintegrated in the stomach acid. You don't have to baby them by keeping them in a refrigerator and throw them out after 3 days and all that kind of nonsense. So it's just lower maintenance.
Do you sell those at your clinic?
Mm-hmm. Yeah.
Just I'd ask. I'm asking for a friend,
of course. Yes. Mm-hmm. Yeah. Definitely.
I'll be calling you.
But yeah.
Good.
So, but yeah, good probiotic is absolutely critical in just maintaining your own immune health. So something that shouldn't be overlooked when we're kind of doing all these other things. And then I think the last thing is just short chain fatty acids. So the probiotics are like the little army that we need to build up in front of that gut wall. And then the short chain fatty acids are the wall itself, right? So that's the way I kind of look at it. So they're going to rebuild those tight junctions between that intestinal wall. Another thing that we often forget is that intestinal wall is only one cell layer thick. So we need to have a respect for it. So as we're tearing it down, because we're eating whatever nonsense food and inflammatory things and whatnot, it is only one cell layer thick. And if we're creating inflammation there, that's going to increase our TH1, TH2, all those inflammatory pathways are going to play itself out. We only have so much inflammatory pathway that we can allocate, right? We only have so much energy that we can give out in a day, right? So if we're already here inflammation-wise, and then we take another hit from an infection standpoint, we don't have anywhere else to go. Mm-hmm. So we don't have any more fight power if we're already here. Mm-hmm. So we've got to take care of that. So rebuild that wall with your short chain fatty acids. Omega-6 to omega-3 ratio is a big thing that they talk about, and that's supposed to be in a 1-to-1 ratio. A lot of Americans are anywhere.
Omega-3 are very heavy dominant omega-3.
Yes.
Which I've read. You need to go back to the parent oils.
Yes, absolutely. So a lot of us are like a 10-to-1 ratio.
Oh, wow.
Yeah.
We're off.
Very off.
Yes.
Very, very, very
and
off.
again, you can sit there and eat all the clean that you want to eat, but really you gotta supplement. I mean, it's kind of like D. Like you can sit out there and get all the sun you want, but you're just gonna get skin cancer at that point. Like just supplement. So make your life easy. Yes, eat clean, do the things, but really you gotta help build as well. Because there's only so many avocados you can eat. Right. So, all right. I think I'm good. Yeah.
Awesome.
Good. Oh my gosh, such good. This is such good information.
I get so excited about it.
I need to go to Sprouts or Whole Foods and go get my stuff after this.
Want to go?
All of that.
Yeah, let's do it.
I know we wanted to bring up exosomes and stem cells.
Yes.
So everybody's been really asking about that, and it's so huge because we gave it to my husband when he had COVID, and huge difference with the anti-inflammatory. So kind of discuss. You've been doing a lot of studies on exosomes.
Starting to.
You know a lot about the stem cells. So you guys kind of.
I mean, I've been.
Let everybody know.
I mean, the whole reason why is I think looking into this is more for the biohacking aspect of it, like the wellness aspect of it. You know, the whole thing I dumped into is my Asians all into, in Asia, let's get injected with stem cells. So my evolution was about 5-6 years ago. Started to do more of the fat aspect of it. Liposuction a little bit, grab it out, spin it out, get your own stem cells out, and re-inject it. Fast forward, we're onto exosomes now because FDA and their whole unsure of what any of this is and how to characterize it. Exosomes, for clarification sense, they're the little vesicles that we used to think were the waste particles that were just dumping stuff out of the stem cells.
Yeah.
It was stem cell poop.
Yeah.
And we fast forward, we actually found out that these little packets are powerful packets that are filled with mRNA, interleukin, cytokines. There's over all these different cofactors, all these growth factors that are in it that literally fuse to the cell membrane and dump out this message, and those messages are going out to these areas that are calling for help and literally just starting that repair process in the body.
Yes.
And so we're definitely noticing the especially in the anti-inflammatory world, we're talking about the autoimmune things and things like that. You're seeing tons more research in the MS world and the ALS world and all these autoimmune things with stem cells and exosomes as really, really doing it. And it's exciting to see where it really can really, really do it.
Yeah.
But, one of the stem cell company that I work with, they just actually already started their COVID studies. Phase 1, phase 2 clinical trials that they actually do. It does really do a lot for it. And they're going to go into post-COVID syndromes, and they're submitting their INDs and IRBs for that sometime in the next 2 months or so. So,
because again, I think the sequela is not going to go away.
It's not. It's an inflammatory response. We know this. And so, ultimately, it's the balance of finding that anti-inflammatory aspect of it, and how do you decrease it. I tell people, it's like kind of like you have a fire in your kitchen and your body went, let's just not call the one fire engine company, let's call all of the fire engine companies around and just douse it.
And so now you have a flood.
When you do that, you have a flood and you kill everything that's part of it. And so, if we can manage that inflammation in the body, which goes with every disease process, honestly, probably that we have.
Chronic Lyme disease, and you've got, post-viral syndromes, mono, and there's so many that this can really, you can extrapolate out to.
And so
amyloid bodies with Alzheimer's.
I'm excited to see where this is going. But just on a skin level, definitely there are certain companies that are making it. I did a talk, or I recorded a talk for the Canadian Expo that's going to be March 23rd, 24th. You can look at Canadian Medical Expo. I was doing some research with some of the companies that do produce the ones for skin that we actually will do after with microneedling, RF, CO2 lasers. We're seeing that these people are healing up so much faster because it literally just like, boom, you put it on and the inflammation just stops in its tracks.
Is it just like, you're just doing it topically?
Yes, topically.
Are you just using like 1 cc? How much are you using?
Well, no. These are companies that make it in a much more reasonable way. It's much more inexpensive. There's a company called Benev that makes one, and there's tons of growth factors, peptides. They've done studies of over 50 growth factors, so way more than your PRPs and the PRF. I'm like, that's
old
because PRP is very inflammatory. Have you guys used it?
Yes.
And we did it over CO2 lasers and microneedling, and then your face, when I put it on there, I'm like, ooh, they're starting to get red. Ooh, they're starting to get a little puffy.
Oh, look at you go.
Like,
wow.
Oh, that's fine. It's going to be like that.
It's going to be okay.
There's only 7 or 8 growth factors in it. Now you get something that's anti-inflammatory, and then it has 50 plus growth factors in it that it literally just stops the inflammation. So now your body can actually heal. Start that repair process at a faster rate. And the pictures that we're getting are so much more.
Oh my goodness.
We've had to change our entire post-op. Like I've had to change my entire post-op instructions for my CO2 resurfacings. Because I will not do CO2 for that reason. People come back and go, it wasn't anything like what you told me it was going to be. And I always tell them, you're going to be brown, it's going to be red, puffy. Nope.
You look like a burn victim
4 days.
A couple of days.
Kind of why I send them to you, because I'm like, I'm not doing
half the time they heal. It's crazy.
Oh, it's insane.
It is. Amazing. I mean, in the studies that are actually starting to come out, they're showing that when you put the exosomes, they absorb right into the fibroblasts within 24 hours. So what they're noticing actually is a 600% increase in neocollagenesis.
Wow.
There's a 300% increase in elastin formation. And the wound closure is going to be 80% within a shorter amount of time.
Unreal.
So the fact of where exosomes in general, just even on the skin level, is showing, I mean, this is opening up a whole new world with regards to just inflammation that we're really
and from what I can see, like it seems to be far less controversial than stem cells, because stem cells I feel like was like on that verge, almost like cheating your taxes. Like you always felt like somebody's gonna be knocking at your door in a minute to like yank your licenses off the wall.
I always tell people, they're like, what is the difference between stem cells and exosomes? And I say the stem cells is like the car and the exosomes are like the engine. And we're just taking the engine out.
That's it.
And just
but
it's like this little heat-seeking missile that knows where there's damage, and that's where it goes.
It's insane.
I tell people it's like having a company. You have the stem cells, your CEO, and all the text messages, all the messages, and all emails that they send out to how to do this and do this.
I don't know, everybody
that's what your
I
exosomes are doing. They're literally telling things outside because it's a paracrine effect. It's not just
it really is.
you affect that one cell. It's you affect that cell, that cell, that cell, that cell. It's a whole body total aspect that is really, really changing on that aspect.
I love that you just use paracrine in a sentence. Like, I haven't done that since second year medical school. That's great.
Just the things I have to read about. Because exosomes to me are super interesting. I get it done now as an IV, just as prevention, just on a slowing down the aging process. It was so funny.
I was like, if you need anything, and Gideon's like, nah, I'm good.
I'm good. I got exosomes.
I'm like, well, I mean, okay, I'll just stay in my lane over here.
It's like Thor over
great,
here.
Right? Seriously. Oh, it's phenomenal. So good. No. Yeah, and we do it for joints, so that's my lane over here is like we do it shoulders and elbows and, all kinds of
the inflammation.
knees.
There's still a lot to learn about it. Like even with joint injections, like there's this talk that you still need the stem cells with the exosomes because you're decreasing the inflammation, but then you have the stem cells that actually do the replication, that actually rebuild the area a little bit more so. So, we're scratching the surface of it.
It's so exciting.
But it's exciting that finally the FDA is allowed, unfortunately had to be COVID that allowed them to actually now get into the realm. So now that they've got their foot in the door to do these studies, now they're like, okay, COVID's here. Yes, we can do some studies with COVID and know that that's it. But now they're going to start showing, okay, see, it also helped this. And then now they can start branching off on their studies and the INDs and the IRBs for that we can really, really start to show benefits. Because, that's the whole thing. The FDA has slowed us significantly down as for the advancement within this field.
Definitely. And that's ironically, that's kind of like the very last slide that I had. It says something to the effect of like, the man who knows everything can learn nothing. And so that's what I want to encourage all of the people who are on here tonight is like truly like always try to strive to learn something new. Try to push yourself to incorporate, and don't be the first on the block to do everything, right? With caution, but
don't look at me.
Learn and read and push, and also don't be the smartest person in the room. If you're the smartest person in the room, you're in the wrong room.
Absolutely.
Like always have somebody who knows more than you in your network of people. Because I think I text Gideon about once a week. Like, hey, friend. And I just asked Lori something right before we started. And so you want to surround yourself with people who know more, at least if not in one field, in a different field. So I might know more about minerals and supplements. They know more about aesthetics. And it's humbling, which is a beautiful thing.
Yeah,
and there's nothing wrong with
learning.
I think it's great.
That's what medicine. Also, makes medicine so cool.
Oh yes,
is that you can never know. You can
never know everything.
Yeah,
and we're always learning things.
Yes,
so
and we should.
Always new research coming out.
Yeah.
Thank you so much for being here.
Thank you.
For inviting me.
Thank you so much.
Really, really fun.
I wish we had 2 hours to just learn this stuff.
Yes.
This stuff is so much fun.
Yes, it really is.
This whole biohacking thing, I'm going to be focusing on this.
Yeah, for sure.
And we're getting to that age group where we're like, I need to like slow it down,
8
like
days.
Pump the brakes on this aging process quicker.
Yeah, it's happening.
I'm further down that hill than you are. Sorry.
There's hope. There's always hope.
Pull me back. Pull me back up.
There's always hope.
For sure.
Okay, so we wanted to go through our contest for this AI.
For this AI Live.
And it's going to be this month until the 31st. So from March 2nd to March 31st. We're going to have one winner. You're going to win 2 tickets to the Aesthetic Show.
Yay.
That is worth $1,390, you guys.
It's going to be live.
It's live.
Yay.
Yes, and we're going to get to see all of our friends at the Aesthetic Show. So here's how to win. We want you to follow us at the Aesthetic Immersion on Instagram. So at the Aesthetic Immersion, find us. You'll follow us on Instagram. Tag a friend that you want to take with you to the Aesthetic Show. And we will announce the winners on our next AI Live on April 6th. So we'll announce that later.
The Aesthetic Show is going to be amazing because it's going to be live.
And they've changed the way it's kind of being done.
Yeah.
So, which is really cool because on Thursday there's a pre-show.
Yes.
And there's going to be a couple parts of that pre-show where they're going to have injectables in a cadaver lab. So that's going to be awesome because who doesn't want to see a cadaver lab? It's awesome because you learn so much from it. And every cadaver is different.
Yeah,
so you learn
that's
how
true.
things are different. So you're going to go through anatomy, neurotoxins, dermal fillers, going to watch injections being done. So that's Thursday.
Okay.
And then on Saturday, there'll be, Friday, all the lectures and such.
So is it more for beginners on the injection
That's
class?
going to be more beginners on Thursday. And then on Saturday, there's going to be a master class.
Saturday is the master class.
So it's going to be pretty cool. And then they're still going to have their certified aesthetic consultant program that's going to be interwoven into the entire.
Nice. It looks like they even have a master class in thread lifting.
Yeah.
So they're going to have a live thread lifting class and then a certified aesthetic consultant. Yeah. So lots of fun things for you guys to look forward to.
So the aesthetic show is awesome. Yeah, it's a good conference. So we'll have 2 winners for that. A winner plus
winner plus a friend
to that. So that'll be awesome. And do you want to announce our
Lastly, it's our March winner. So this is from our last AI Live. We decided to do a full preceptorship day with either one of us, depending on who you chose. Mostly should have been her.
All the names were put into a little bucket, and the staff just drew a name out.
Yes. So Stacy Suzuki. I actually was hanging out with you yesterday. We were doing a private training with Dr. Rahi out in Beverly Hills, and she's one of her staff. So I was actually sorry.
So you get more time with Gideon, Stacy.
So I will see you. Reach out to one of us. Reach out to Aesthetic Immersion or me, and we'll get that set up. But congratulations, Stacy.
Awesome! A whole day of playing with this guy.
All righty.
Thank you so much for being with us. We appreciate it. We hope you had an enjoyable AI Live.
If there's any questions on things that we talked about, we'll put up her PowerPoints if you guys want it or anything like that. Email us at learn@theaestheticimmersion.com, and we'll see you at the next one.
We'll see you next month. Thanks for joining us here, everybody.
Bye, guys.
Bye-bye.
Hey, Lori, you know what?
What?
The next AI Live you get to host by yourself.
Where are you
on vacation.
That is so not fair. Yes. You are going to miss an amazing AI Live. We are going to be talking about skin, everything skin. So if you're talking about rejuvenating skin, thickening skin, tightening skin, all that good stuff, you're going to miss it.
Maybe I'll join in.
Hey, guys.
Hi, Brian.
Hey, what's going on?
I don't know. You tell me what's going on.
We are just talking about our next AI Live. You're always behind the scenes. This is Brian. He is our utility guy. He builds everything. He's marketing. He's our ute.
Yes. Yeah. And I'm a joke teller. I got one.
Oh, really?
Why is Botox overrated?
Why?
Because it'll never make headlines. What? That's a good joke. Man.